Thank you for joining us for this webinar program. Today we're thinking about our thinking, and I'm joined by Dr. Luke Smith. I'm Andrea Salmon, and I'll be the facilitator for today's webinar. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present, and emerging, on whose lands we meet today, no matter where we're dialing in from. I'm currently on the lands of the Wurundjeri people of the Kulin Nation. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we also respect the cultural authority of the elders in each community. It is my pleasure to introduce you to Dr. Luke Smith. Luke is a clinical neuropsychologist who works privately in the community, including consultations in Victoria and Tasmania. So some of you might have met Luke. Previous to gaining his qualification as a neuropsychologist, he worked as a behaviour management consultant for Alzheimer's Australia, both in Victoria and South Australia. Luke has a research and clinical interest in progressive neurological conditions, particularly those affecting younger people, although those conditions associated with movement disorders. Luke also has a passion for education and skills training in this whole area and in the aged care sector. And we have a lovely relationship with Luke, and he is a great presenter. So I'm sure you're going to appreciate everything that he has to share with us today.
So guys, it's such a pleasure to be here today, and thank you so much to MS Australia and Andrea for inviting me to come along. I'm a neuropsychologist, and I'm going to talk a bit more today about what that means. But in particular today, I'm going to talk to you about some topics that often, I think in the MS area, we don't often talk about, or sometimes we don't understand. So I'm going to talk about your thinking, and I want you to think about your thinking. That's why we have the title of the talk. So just as a general outline of what we're going to cover today, I'm going to talk a bit about MS and the brain. The neuro part of neuropsychologist gives you a hint that I'm a bit of a brain nerd. Then we're going to talk about parts of your cognition that can be affected by MS. Cognition, that word really just is a fancy term for thinking and memory type skills. Then what I want to talk a bit about is what neuropsychologists do, what a neuropsychology assessment is, which will give you a greater understanding of how your awareness and knowledge of your thinking and memory skills can maybe help you day to day. Then, once we've sort of talked a bit about that area, we're going to go into some strategies. And there's three particular areas I want to focus on today, because in my clinical experience, in the work that I do, when I'm working with people living with MS and maybe sometimes their families as well, there's three areas that they particularly find issue with. The first is thinking speed. So I'm going to talk a bit about managing your thinking speed. Then we're going to talk about some strategies for your concentration and your attention. And then we're also going to look at some memory strategies. But these strategies and this information is no by means an exhaustive list. There's lots of research and great evidence and great strategies and techniques around how we can manage the thinking and memory symptoms of MS if we're experiencing difficulties in those areas. So thank you so much for being with me today. I'm really grateful for being able to talk to you, even if it is remotely on a webinar. When Andrew and the team originally approached me about doing a webinar for people living with MS, I'll admit to you guys, I was pretty nervous, probably more nervous than doing a talk to like medical professionals or health professionals. The first one is because in some ways, to be honest, you are the experts on MS, not me. I don't have MS. I can understand it from a scientific point of view. I'm grateful for the insights I get from guys like yourself. But I don't live with the condition, and I've been in talks before where someone's maybe someone's talking about MS while people with MS in the audience, and it feels like they're kind of the test subjects, or maybe they're the test tubes. So I want to make it really clear. I hope that I'm not too patronizing today. You are the ones living with this condition. I am not an expert on MS, probably more so you are, but hopefully the information I provide today might empower you or answer some of the questions you've had for a while. The other one is that there's nothing worse than being lectured at. And in fact, we know that for adults particularly, unless you are actively engaged in the learning experience, then you don't really learn a lot. If all you're doing is sitting back and trying to listen about the information, you won't take in a heap. So what I decided to do is to try and make this interactive. So you can see here on my slide, there's two different icons. That blue speech bubble, let's make this interactive, is where I'm going to throw over a question to the audience. And it's great that Andrea showed you before where you can type in those questions. Unfortunately, we may not get around to all of them, just given we've got so many people attending today. But if you do throw questions out there, and I'll prompt you with a slide, hopefully I can answer some of them. The other one down the bottom, which looks a bit like a red signpost, is where we're going to do some polls. So that's a bit like the poll you had at the start about where you're located. And it seems like the majority of people are located in New South Wales and Victoria. So when that comes up on your screen, we'll open up the polls and Andrea will be able to walk you through that, and then we'll look at the results. That's always really interesting. The other thing I wanted to acknowledge is that this year has been different to many, many years in our lives. And it is somewhat ironic that most of us are in New South Wales and Victoria, where unfortunately most of coronavirus has occurred, or we've had very high numbers. So today I want to just encourage you that if anything I talk about today does stir some emotion in you, and that is a bit more distressing than you would like, or it's, you're thinking about it for days and weeks afterwards, I really encourage you to touch base with the people that support you for emotional support, or if you have a psychologist or a counsellor or even a good GP, that you do so as well. Just make sure that you emotionally feel stable and that you get support if you need to. Hopefully the topics won't do that, but I always like to put it out there because we're talking about your lives in this webinar today. Okay, without further ado, I love this picture. This is a neuron, or what you might think of as a brain cell. And the reason why I put this up here is just firstly to acknowledge that multiple sclerosis or MS is a neurological condition. And it absolutely can affect your thinking and memory skills because your brain is responsible for your thinking and memory skills. Now, MS, as you know, generally affects the myelin in your brain, on your neurons. And the myelin we think about is a bit like the rubber coating on a wire. It's a bit like the insulation. So MS unfortunately attacks this part of the brain, this myelin sheathing on brain cells, and it can cause inflammation and it can cause damage. Now, myelin does occur on what we call the white cells, and there's quite a lot on the white cells. The white cells in our brain are a bit like the connecting wires between things. In this picture, it looks a bit like the axon. So those white cells are heavily coated. But the grey cell, which is what you can see there, the nucleus, the cell body, around that part, that also has a bit of myelin as well. So in the past, where they used to think that MS really only affected these connecting wires in our brain, we now know it can also affect the myelin that coats our grey cells, which is a bit like the hard drive cells, our computer cells. One of my learnings early on in my career, which was absolutely fascinating for me, and maybe some of you were better educated than me at that stage, is I saw a young woman in her 40s who'd been living with MS for quite a long period of time and coping incredibly well with the help of her family. She came into a hospital that I was working in just for some rehabilitation due to physical symptoms she'd been experiencing because of MS, and she did fantastic in her rehabilitation. And while she was with me, I did a thinking and memory assessment, a neuropsychological assessment, which we'll talk about a bit more later. But what was quite striking is that while she was in the hospital with us, she had an MRI brain scan done, probably a scan that a lot of you have had done in the audience. And what that showed, unfortunately, was that there was quite a lot of MS in her brain. So this is my bias and maybe not understanding the situation well enough, was that I just assumed that on my thinking and memory tests, she was going to do really poorly. But guess what? She didn't. She actually did really well. And in fact, I went through and double checked all of my data analyses on the thinking and memory tests I'd given her. And what I came to learn through looking at a lot of research was that whether you have thinking and memory difficulties or symptoms that are caused by MS is actually not due to how much MS you have in your brain, it's the location of the MS. And that actually does make sense. Different parts of our brain are responsible for different things. So it's really important to keep in mind that whether or how many thinking and memory difficulties you might have due to MS is actually not how much MS you have in your brain, it's where the MS is located. Most research shows that if you take a group of 100 people with MS at any journey of their illness, between about 40 to 65% of people will have thinking and memory difficulties that are caused by MS. I like to think of that as an easy way around. About half of people at any one time might have thinking and memory difficulties caused by MS. You can also, as part of a relapse, as part of an active episode, you can also have thinking and memory difficulties. So this is often a reality for people with MS that they're living with. So I just wanted to put it out there, though, that not everybody in the audience will be experiencing thinking and memory difficulties because of MS. So, depending on where MS is occurring in your brain, and if you are experiencing thinking and memory difficulties, they can actually occur in different ways. And what I'd like to go through now is different parts of our cognition, or our thinking and memory skills, and how they can be affected. The first one, which is quite a common symptom of MS, is a change in what we call our information processing speed. You might think of this as your thinking speed. So what occurs, particularly because with the myelin sheathing on those white cells, those connecting wires between our brains, you can imagine that as that myelin becomes inflamed or there's damage to it, it just takes longer for the messages to communicate and to move within our brain. And therefore, it can take us longer to process things. And day to day, for people, this can be sometimes that they just take longer to think their way through tasks. It can be that they're a bit more delayed when they're trying to find the answer to a question. There's a number of different ways that this can occur. It can also occur independently of physical slowing. So we know that for people with MS, sometimes how quickly they can move will slow down a bit. But even for people who can move their arms and legs, move their body quickly, their motor quickly, sometimes their thinking is still a bit slow. The next one is attention and concentration. Now, this is something that generally fluctuates a lot day to day for us anyway. But the changes that can occur for people with MS with their attention and concentration is a reduction in attention span. So by attention span, what I mean by that term, it's actually how much information you can take in at one time. We often use attention span like I think my teacher accused me of having the attention span of a goldfish. But the attention span, what we think of from a neuropsychology point of view, is how much information you can take in at one time. So for the average adult around the world, regardless of their gender or ethnicity, usually we can take in 7 bits of information plus or minus 2. So most people, most adults, can take in 5 to 9 bits of information at one time. That might be during a conversation with somebody. If MS is affecting this part of your cognitive functioning, it might be now you can only take in 3 or 4 bits of information at one time. What that can mean, particularly in conversation or when you're watching movies or when you're reading a long newspaper article, is that you're just not able to take in as much as you used to. There might be more information you're missing. The next one is what's called sustained attention. This is your ability to concentrate for long periods of time. Now, a neuropsychology assessment, a really thorough one, can take between 3 or 4 hours. It can be quite a long assessment. And during that time for people with MS, when I'm providing an assessment for them, sometimes I can see their concentration just wander in and out. Sometimes they get distracted by things and I have to bring them back. Sometimes they seem to lose focus on things. Sometimes even when they're speaking to me, they might lose track partway through, part mid-sentence. So this can be an issue as well. The last one on the screen you can see is actually divided attention. From a thinking point of view, this is what you might think of as multitasking. Your ability to be able to concentrate on multiple things. Now, in this space, a human brain can't really concentrate on 2 things at the same time. What our brain does is very quickly switch our concentration, switch our attention back and forth between things. A great example of this is driving. So if you're watching your speedo, you're then checking your blind spot, you're then changing your gear, you're then changing the radio, you're then coming back to your steering wheel, constantly switching your concentration back and forth between things. This can also be a change for people with MS, depending on where MS is happening in their brain. And working memory is a really important one because like thinking speed, this is quite a common change for people with MS if they are having thinking and memory difficulties. Working memory is your ability to hold information in mind whilst manipulating it, whilst working with it A great example of this is actually mental arithmetic. Now, I don't know if you're like me, but I am that person at the supermarket that when I get my docket, I tend to check it just to make sure I got the special on the ice cream. I look suspiciously at the checkout person, making sure I got all my discounts. Now, the way that I work out whether I got the discount on the ice cream is actually through working memory, using mental arithmetic. The next one, which is a really interesting term, is called Visio spatial processing. I'm not sure whether you've ever heard of that term before, but particularly if you've worked with a physio or an OT, this is often an area that they might talk about. For those of you at home that have a pet, particularly if you have a dog, I want you to think about your dog's dominant sense. So what do they use the most? Do they use hearing, smell, sight, touch? I'm not sure if you know this, but for your dog's dominant sense is actually smell. So if you look at a dog brain, there's a really big part of that brain that's dedicated just to understanding and processing smell. For humans, our dominant sense is actually our vision. But without our brain, our eyes are blind. Our eyes simply take in the raw data of what is around us, but it's our brain that makes sense of it. So our brain actually helps us to understand and organize visually based information, what we see. People with really strong visio-spatial processing skills usually are people like tradespeople or handy people or artists or architects or even bricklayers, people who spend a lot of time interpreting and working with visual information, what they see. So this can be a change for people with MS. The next two areas I particularly want to focus on, because when I speak to people with MS and they talk about what changes they may have noticed in their thinking memory, this is usually the two areas. The first one is learning and memory. Now you'll notice on this slide, I've called it learning and memory, not just memory. Because a lot of people, surprisingly, with MS will tell me they have a memory problem, but when I finish my assessment, I actually say, you don't have a memory problem, and they're a bit confused by that. So let me explain why sometimes, particularly in the early stages of MS, why that can occur. So for the purposes of the talk today, I want you to think about memory as three stages. The first stage is learning, which is what you're doing now, hopefully, taking in information. The second stage is storage. So that's when you're storing it in your brain a bit like a computer. And the third part is actually remembering. So that's when you're actually taking the information out of your brain, such as maybe tomorrow morning when you wake up, trying to remember what I was talking about today. Now you can imagine that if your thinking speed is a bit slower, if your working memory or your concentration is not quite as good, then generally you're not taking in as much information. In other words, your learning is not as efficient. So what looks like a memory problem can actually be a learning problem. Now, when we talk about remembering, that's the act of taking information or trying to recall information. There's actually two different ways that I measure it as a neuropsychologist. What we call free recall memory and what we call recognition memory. Free recall memory is when you have to remember something off the top of your head, such as when's your next doctor's appointment? That's when you have to kind of think, oh, God, I can't really remember. Recognition memory is when you have a prompt or when you have assistance with remembering. So it might be, is your doctor's appointment on Wednesday, Thursday, or Friday? And you get that light bulb, Thursday, that's right. So two different kinds of memory. Free recall memory, which is straight off the top of your head, and recognition memory, where you might have a bit of support with remembering. Generally for people with MS, if they do have a memory problem rather than just a learning issue, it's usually the free recall one they have most difficulty with. That's when we're trying to remember information just off the top of our head. But usually, as soon as I prompt them with multiple choice, with yes or no, with reminders, those light bulbs start to go off. And that's why we'll talk a bit about later how we can use technology to help our memory if we do have memory or learning difficulties because of MS. A question sometimes I get from people with MS, particularly if they have had a relative or known someone with a condition like Alzheimer's disease, is about memory. So I want to make it really clear that for people with MS, long-term memory is usually a strength. So that is all the memories we've got stored within our brain, and our long-term memory is actually stored quite diffusely within our brain, meaning we store it in lots of different parts of our brain. Usually your long-term memory is very strong for a long journey of the illness. Unlike people with Alzheimer's disease, unfortunately, when they do start to lose some of their long-term memory and regress to childhood memories, that's not usually the situation for people living with MS. Okay, this next area is called executive functioning. It's a fascinating area, and once again, an area of complaint often for people living with MS when they do have changes in their thinking. So I'm going to walk through this area right now, but in general, executive functioning is functioning that we think is related to the front part of our brain and also the lower parts of our brain, and maybe how they work in combination. Now, why this can be an issue is that our frontal lobe, particularly the right part of our frontal lobe, has a lot of white matter in it, a lot of these white cells, these connecting cells in it. And also, you guessed it, the lower parts of our brain also have a lot of this myelin sheathing on lots of those brain cells and connections. So that's why sometimes we can see this issue. But executive functioning covers lots of different areas. The first one is actually what we call insight. To demonstrate insight, I'm actually going to give you a riddle to try and solve. I'm going to get you to use your frontal lobes. And by the way, if you don't solve this riddle, it doesn't mean you have an executive functioning problem. So here we go. If you hurt your leg, or if you broke your leg, what part of your body tells you you're in pain? What part of your body tells you there's something wrong? Now, for those who said leg, that's okay, but it's actually your brain. Without your brain, your leg doesn't feel anything. So when you go to the doctor and the doctor says, unfortunately, you've broken your leg, you need to stay up for 6 to 8 weeks, you need to wear this moon boot and don't drive, what part of your body allows you to understand what the doctor is saying and then relate it back to your broken leg? You probably guessed it, it's your brain. So here's the riddle. What part of your body tells you there's something wrong with your brain? And this is the issue of insight. Sometimes people with MS, particularly when they have thinking and memory changes, will be accused of being in denial, being stubborn, but in fact, they just don't have as much insight into what's going on for them because their brain is not allowing it. MS affects our brain, and therefore sometimes our brain doesn't actually tell us exactly what's going on or what's wrong. And this can cause a lot of conflict in people's relationships particularly. The next one, idea generation, is simply being able to come up with ideas quickly. Inhibiting automatic responses is when we have all these automatic things that happen in our brain, and unfortunately sometimes that filter starts to not work so well. So we might start to say or do things that might seem inappropriate or rude, but it's simply that we're just not able to filter out and control as much of what's happening in our brain. Reasoning and problem solving is another change that can occur. People can just feel a bit more stumped when they're trying to solve problems. Sometimes their thinking can become a bit more black and white. Once again, this is not someone's fault. This is a symptom that can occur because of multiple sclerosis. The last is planning and organizing. And what I mean by that is not just how we plan and organize our day, but literally how our brain plans and organizes the information when it comes into our brain. So for example, when I'm doing thinking and memory tests with people, sometimes I can actually see them using strategies to give them more efficiency, like when they're trying to learn a story or when they're trying to tell me a whole lot of animals. So this is the way that executive functioning works. It's the more complicated parts of our thinking. So what I'd like to do now, Andrea, is I'd like to ask the audience, have you noticed any changes in your thinking and memory? And what are those changes? And if you can please type it in to that section, we'll try and cover a few in the time we've got now, just so we can share with the audience. And please only share if you're comfortable, keeping in mind that your name does come up.
Absolutely. Thank you, Luke. While people are typing in that, can I ask a question?
Please.
Tamara has raised with me and it's a little bit complicated to explain, but the overlay of emotional trauma, so that has an interplay with some of the cognitive change maybe.
So absolutely, Tamara, and in fact I cover that a little bit later in a brief bit, but it's a great thing to do now, I think, particularly as what we've all been going through during COVID. So we know from research and obviously your experience that people living with MS are at a higher risk of mental health issues, if you like, things like depression and anxiety. And we know that whatever underlying thinking and memory issues might be caused purely by MS will actually be compounded if your mood is low, if you're feeling really anxious, or if there's some other sort of mental health thing going on for you. Now, it doesn't mean that it permanently causes damage to your thinking memory, but for that time when you're feeling anxious or your mood is low, generally it will put a bit more of a blanket on your thinking memory type skills. Absolutely.
Yeah, for sure. Thank you. Alison says her thinking is sluggish.
Yeah, and people often talk about this idea of brain fog when it comes to MS, which I love as a term. Unfortunately, I can't put it in my reports because it doesn't sound fancy enough, but that sluggishness can feel like what we call things are more cognitively effortful, meaning it's much more effort to think and remember. Sometimes that can be a sign, and I'm not, by the way, diagnosing this as any way, but sometimes it can be a sign that our thinking is a bit slower, but it also can just be a general sluggishness that we feel we have to put more effort into our thinking memory. So this cognitive fog is quite a common complaint that people with MS have.
Yeah. And Anne says sometimes she says things that she doesn't mean to say.
Yeah, so and that can be due to two different things. The first one can be that inhibiting automatic responses. So it could be that sometimes, to use that lovely Australian term, the ball is slipping through to the keeper. So sometimes we say things we don't mean to. But also, and I haven't put it up here today because it's hard to cover in a talk of this length, and I usually leave it to my speech pathology colleagues, is that MS can also affect your language. So there's a really great term which is called a semantic paraphasic error. But what that basically is that when you go to find a word, you use a similar word that's related but not the same. So I might try and find the word lion and I say tiger. I might try and say the word pizza, but I say spaghetti. So even though they're sort of in the same category, I've actually not used the word I wanted to. So that can be a really common experience for people too.
Yeah, fantastic. I've lost who it was, but someone made the comment that it is very related to fatigue.
Absolutely. And I'll put that on a bit later too, guys. It's so great when you start to write my talk for me. I have got that down. No, it's great. It just shows how well educated you guys are. So it's not just about our mental health, it's also about fatigue. And I honestly believe that unless you live with MS, you don't actually know what fatigue is like. Because the way that people with MS describe it to me, or they walk into my clinic room with it, it just seems so exhausting. And we also know that your fatigue can also be really affected by temperature, particularly hot temperatures. So and particularly the day after a really hot day, that fatigue can be worse. So whenever I'm doing an assessment for people with MS, I always try and measure their fatigue. And absolutely, a bit like your mental health, high levels of fatigue can once again cause that cognitive fog or just make those thinking and memory skills a little bit worse for that period of time when you're fatigued. Great point.
Absolutely. And Lisa made a great comment. One of the first things she noticed was the inability to remember numbers, as well as less ability with mathematical problem solving.
Yeah, so I think what you're probably talking about there is working memory. Working memory is very reliant on when we're using numbers. And sometimes also the way that our attentional span works can also mean we don't quite take in and remember as many numbers as well. So look, it's actually quite a common thing. I remember last year I was working with a gentleman with MS who was actually an accountant. And more he was having to rely on technology to do his calculations and that sort of work rather than just doing it all in his head like he used to be able to.
Yeah. Jane notices her concentration is impacted, especially when there's lots going on around her, particularly noise.
So sometimes that can be hearing, but if you know, Jane, that your hearing's okay, then maybe it is this divided attention, this multitasking, being able to switch our concentration back and forth between things, or maybe it can be that your attentional span might be a little bit less, so you're not taking in as much. Sometimes it's a bit difficult to know exactly why these things are happening, but what you guys are reporting is really common for people living with MS. So I thought if it's okay, Andrew, we might move on just for the sake of time, but thank you so much for your reflections, guys. And I'm hoping that this next section might be able to start to look at and explain, or how do we investigate when you are experiencing thinking and memory difficulties. Okay. Oh, I forgot, sorry guys, I have a poll. So what I'm going to talk about next is what I do as a neuropsychologist. So my poll for you is, have you ever seen a neuropsychologist before? And I'm going to throw over to Andrea for this one.
Cool. So I'll launch that one. It's a pretty simple yes or no response, just finding out for the people that are online at the moment if you've ever seen a neuropsychologist. So again, with your mouse, you can click on either of those options, and I can see that 74%, 75% have responded. I'll a couple more seconds to get all those responses in, but just letting us know if you have actually ever seen a neuropsychologist before. So anyone else like to vote on that? And I'll close that off. I know if you're on a phone, you might not be able to vote. So I'll close that and show you the results. So 73% have not seen a neuropsychologist, 27% have.
And can I say, guys, thank you, by the way, for doing the poll. That's quite a common thing. Unfortunately, there's not heaps of neuropsychologists around, but also a neuropsychology assessment can take quite a long period of time. So what I want to talk a bit about is about what I do as a neuropsychologist. I'm in no way saying you have to see one, by the way, or even have to see me, but it's just something to keep in mind that it's an option if you do think you're experiencing some thinking and memory changes caused by MS, because we know from research that thinking and memory changes caused by MS can have a massive impact on your day-to-day life. So often when people see their neurologist or a neuropsychiatrist or another allied health professional, they might get what we call a cognitive screen. A cognitive screen is quite a short thinking and memory test. It usually only takes 5 to 10 minutes. And that can be really useful for tracking your thinking and memory over time. But cognitive screens don't cover really all of our thinking and memory skills that we use. They also don't tell us things such as what your pre-morbid level of intelligence is. Pre-morbid means before you got MS. Where should your thinking and memory have been? So I'm trained in estimating that, because if we're going to look at if it's changed, I need to try and estimate where it should be. So if you haven't seen a neuropsychologist, I completely encourage you, if you don't have access to one, encourage you to talk with your medical specialist or allied health professional about doing a cognitive screen. But a neuropsychology assessment like I do is much longer and more in depth than a cognitive screen. So a neuropsychology assessment, as I said, for me, usually takes about 3 to 4 hours. It might be a bit more, it might be a bit less, depending on the neuropsychologist you see and depending on the issues you're experiencing. The reason why it is quite a long assessment is because your brain is really complex, and it's actually quite hard to measure thinking and memory. Like, we don't have a blood test that tells me about your memory. We have to use thinking and memory activities. So a neuropsychology assessment usually will involve an interview where I'll talk to you about your history, not just your history of MS and maybe thinking and memory difficulties you might be experiencing, but I also look at the development and maturation of your brain over time. So I'll talk to you about your developmental history when you're young, about your work history, about your school history. I'll talk to you about your medical and mental health history, just in case there may be other things apart from MS that might affect your thinking and memory. We then do cognitive testing. So we look at lots of different areas of your thinking and memory. Some of the ones I touched on before, but also more than that. We cover lots of different areas. And the way that we do that is we sit down at a table face-to-face doing the assessment, or like we've had to do during COVID, we've adapted our assessments also to be able to do them over video conferencing. Another part of this assessment, and an area that I sometimes talk about with MS, but we haven't had a time to cover today, is that I also measure people's mood. So I will talk to you about your mental health and maybe give you some questionnaires, but also your behavior and your personality. So for some people with MS, and it's something unfortunately we don't have a chance to cover today, MS can actually affect our behavior and our personality. Then what I do is I analyze the results from all your thinking and memory tests and all the information you've given to me during an interview, and maybe information I've got from your doctor or your OT or your physio. Once I've done that, I put it together in a report. We do a feedback session where we go through what all the results mean. And then we also look at strategies and techniques that might help any thinking and memory weaknesses you may have developed because of MS. So in other words, we do therapy. And there's really great evidence around this to show that particularly cognitive rehabilitation strategies are really effective in these areas of MS. But it's important that when we do this, that the information is based on data. So what I mean by that is if you came to me without any assessment and said, look, I just want some cognitive strategies, I could absolutely give some to you, but I don't know if they're going to work because I don't know how your thinking and memory works. So that's why this assessment can be really good, not just confirming if there might have been changes in thinking and memory because of MS, but also what we can do about it. So that's really important. For the strategies I'm about to talk about for them to be effective, we'll talk a little bit how we target them. But the information you get from your neuropsychology assessment can be used for lots of different things. So we can look at your cognitive symptoms, we can look at cognitive rehabilitation strategies, we can also monitor over time how stable your thinking and memory is, whether it's declining, whether it's improving with treatment. And we actually do that using special mathematical techniques called reliable change indices. So a lot of what I do is actually based on psychometrics and mathematics. That's part of my training. We can also use this information for decision-making capacity. That's things like powers of attorney, whether people can manage their own finances or whether they need support. We also can use this information for emotional and behavioural support as well. So this assessment, a neuropsychology assessment, can actually answer lots of different questions and can be used for lots of different situations. So let's talk a bit about strategies. So once again, just to reiterate that strategies are going to be most effective, or we can have more confidence in them when they're based on information that's been gained about your thinking and memory. Now that could be a cognitive screen, one of those shorter thinking and memory tests, or if we're lucky, it could be a full neuropsychology assessment, which will look at your strengths and weaknesses in your thinking and memory skills. These strategies need to be targeted. What I mean by that is a strategy that works for you may not work for another person living with MS. So it's really important that they're tailored. And this is really a great example of person-centered approach, making sure that we are adapting and using these strategies specifically for your thinking and memory. The other thing that we know from research is that these strategies are best when we work towards a goal in your daily life. What I mean by that is that, let's say you do discover that your thinking speed is a bit slower. And how that's affected you is that it now just takes you so much longer to cook dinner, to process the recipe in your head, to multitask between the different things on the stove. And your family are in the background, or your friends saying, when's dinner ready? And you're thinking, oh, this is so much pressure. I used to be so much quicker at this. The best situation to use these cognitive rehabilitation strategies is actually when we're trying to work towards a goal, such as I want to be more successful when I'm cooking. I want to be able to get there quicker, or like a work-related task. When we just generally provide these strategies, they're not as effective. But if we can incorporate them into your day-to-day activities, if we can practice them in that way, that's when we know we have the most success with them. I also just wanted to make a note about brain training. And I'm in no way, by the way, discouraging anyone from doing any sort of brain training online, like brain training type games, because a lot of people find them fun, they find them stimulating, and it feels like they're really trying to manage the cognitive symptoms of MS. But I have to be honest and tell you that there's not a lot of convincing evidence that brain training actually works like cognitive rehabilitation. So what I mean by that is that if you're doing a brain training game, you probably get really good at the brain training game, but research doesn't clearly suggest or consistently suggest that that then applies to the rest of your life. So let's say I'm doing like a memory training game. That doesn't necessarily mean that I'm then going to be able to remember lots of things in my life much more easily. So I'm not discouraging people from using brain training. I'm just saying that the evidence is not there, or convincing evidence to suggest that you somehow can then generalize all of these brain training abilities to the rest of your life. It is best that we practice our thinking and memory strategies in the task in our life, such as cooking or work or doing our finances or doing our tax. It's important that we learn those strategies, how to use them in the actual activity itself. Okay, so I'd like to throw a question over to the audience, and I'm going to get Andrea to pick out some ones. And once again, apologies, we can't get to everybody's just for the sake of time. What thinking and memory strategies do you use? I often find that even though I have a great knowledge of the research and what strategies that are effective or can be effective, people come up with some amazing ideas. With their permission, I get to pass that on to other people with MS. So the question is, what thinking and memory strategies do you use?
That's great. Thanks, Luke. We've already got coming in lots of calendar reminders, writing things down.
Excellent. Love it. Love it. That's I have a calendar and diary myself, but we know from research that using technology, whether it's low tech, like a paper diary or a calendar, or high tech, like a smartphone, using that as your memory prompting is often much more effective than me teaching you fancy rhymes or, acronyms to help your memory. That's great, guys.
Yep. Managing the heat is another suggestion. The reminders in my phone.
And that heat is so important because, as a member of the audience pointed out before, fatigue can have a massive impact on your thinking and memory. So that's fantastic.
And then there's a question about do you have an opinion on programs like CogMed?
Look, I'm not aware of CogMed specifically myself. In terms of online stuff, there's two different ways that it works. Some online programs are used to measure your thinking and memory. So I don't know what CogMed is exactly, whether it's a cognitive screen, meaning it's something to measure your thinking and memory online you can do yourself, or whether it's a program like a brain training program. What I would say from the first point is there are actually some really good online tools that have been developed, with big research studies and by scientists and medical professionals that can measure your thinking and memory in a reliable way, rather than a Winnie the Pooh personality test. In terms of the brain training though, and I've looked at the research and I'm happy to be updated by people, there isn't convincing evidence necessarily that doing lots of online brain training will then generalize to the rest of your life. It's enjoyable and it can help you get better at the brain training games, but it isn't necessarily going to generalize then to the memory in the rest of your life.
Yep. There's a great one here about putting things back in their spot.
Yeah, now it's interesting you say that because I don't know about you guys, but we have dump spots in our house, which is where you put down your keys and your wallet. And I find that people with MS, particularly when it's an attentional issue, so maybe they're not able to pay attention to things as well, is that they will lose items around their house, or that typical experience of walking from one room to the next room and forgetting what you've gone into the room for. So I find that actually having, I know it sounds strange, dedicated spots where you put things like someone in the audience said, is really useful. And in fact, I've even worked with local men's sheds to design like clear perspex boxes that people put in so they can actually see what's in there too. So there's all sorts of different ways you can do that, but that's a great memory strategy.
That's great, yeah. And Alison says when she needs to buy something, she leaves the old packet out so that it prompts her to add it to the list.
Brilliant. And Alison, what that is looking at once again is this idea of recognition memory. So you might think back, I said there's two different ways of remembering for the purposes of the talk today. Free recall memory, which is off the top of our head, which is often harder if we are experiencing memory problems caused by MS. But recognition memory, prompting, which is what you're doing, usually works really well. Now, memory is not just about remembering what we hear, like a conversation, it's also remembering what we see. So visual memory occurs as well as verbal memory. And that's why I really like that about leaving out the item you want. I don't know if you're like me, but it may not work so well because I just be leaving out chocolate packets all the time. So maybe I won't use that one.
Make sure they're on the list.
Yeah, that's right. That's right.
Someone else made the comment about they find their memory is clearer in the morning. So where possible, they schedule their tasks around their best thinking time.
So perfect, guys. And I can explain why that is. So we have in our brain is our sleep-wake cycle. We actually call it our circadian rhythms. Our sleep-wake cycle is actually regulated by lots of different things, but we are, as humans, all of us, more tired in the afternoon than we are in the morning. And that's why people in different cultures and different countries around the world have siestas. I mean, that's why on a Saturday afternoon, sometimes I'll fall asleep in front of the cricket. It's a normal part of our functioning. We are just as tired in the afternoon as we are often at 9 o'clock at night. So I think that's great that you schedule in maybe activities that require more cognitive effort, more thinking and memory skills in the morning, because you generally will be sharper. And by the way, it's an individual choice and obviously it depends on your routine. The research shows that actually if you're really fatigued, sometimes having a nap or just a brief nap in the afternoon, between 2 or 3 o'clock or a little bit earlier or later, can actually then improve our thinking and memory after that time. Some organizations around the world like Google and Microsoft, big companies, in some of their offices actually have a couch in your office so you can have a sleep in the afternoon, because they found that after 3 o'clock, people's efficiency just dropped off. Whereas if they have a short, brief sleep or a nap, their efficiency comes back again. So fantastic, guys. Great reflections. Now, in the spirit of that, I'm sorry we can't get to everybody's, but I'm aware of time, and hopefully we'll have some time for questions at the end. I then want to go through to talking about some thinking and memory strategies. So the first one you can see here is about speed. And the reason why I put this up is that this is a really common thinking change that can occur. A slowing of people's thinking speed, a slowing of how quickly we can find words when we're talking, a slowing of how quickly we can come up with ideas when we're problem solving. Now, unfortunately, in this space, there is no really strong strategy beyond being aware of your time frames. So we all in our lives often sleepwalk our way through the day a bit, meaning we just line up all of our ducks in our routine and then we want to get everything done. The issue is that if you're particularly fatigued or you're having mental health issues, or if your thinking speed is slower because of MS, it will take you longer to do things. And the more that we try and rush, or if we don't try and compensate for our thinking being a bit slower, it causes anxiety, it causes pressure, what we call this feeling of time pressure. So what I'd really strongly recommend you do, if you know your thinking is a bit slower or you think it might be, is be really aware of your time frames. When you're talking, when you're completing activities, when you're doing things. Because often with MS, it's what we call a storage issue. What I mean by that is that it's not that the ideas or words have disappeared, it just takes you longer to access them, to bring them out of the storage. And there's nothing more frustrating when you're trying to find the word and you know what it is and someone just jumps in and doesn't give you an opportunity to express yourself. It can really reinforce for us this sense of failure, that there's been a change for us. So I strongly recommend you just consider your time frames, time pressure. And if you need to, if someone's rushing you, just say to them, look, I saw this talk by, and you can use my official title, Dr. Luke Smith, clinical neuropsychologist, who's told me, you need to stop putting time pressure on me. I need to take my time with these things. It's really important. Now, the next group of strategies I wanted to explore is really to do with your attention and concentration. And fantastically, some of you have already touched on some of these things during the talk today. So the first one, which I've got at the top of the pyramid, is called chunking. I love this strategy. There's a great evidence base behind it. You might remember before that I said that for some people living with MS, their attention span, so how much they can take in at one time, reduces. So maybe you could take in this much information, and now you can only take in this much. Chunking is when you break down a large piece of information into smaller sections, or you use a strategy that allows you to find a pattern in that information. I'm going to give you an example. So if you think about our mobile phone numbers, when we tell someone our mobile phone number, we don't say 0455 555 555. We say to people 0455 555 555. So we are actually chunking quite a long series of numbers into groups of 3 or 4. So for that person in the audience before who said they're having a bit more difficulty working with numbers or remembering them, why don't you give chunking a go? Break things down into small bits of information. You can also use chunking for things like a shopping list. So you might have just a series of items on your shopping list, but if you can identify a pattern in those items, like which things are for the kitchen, which things are for the bathroom, which things are personal items, which things are dairy, you, by finding a pattern and grouping things together according to if they're dairy or meat or bathroom, this frees up more space in your attention and means that you're more easily able to remember it and take it in. Chunking is fantastic, guys. Have a go at that if you want to. Try and control distraction and noise. And the reason why I say that is that if your working memory or your ability to switch your concentration back and forth between things has been affected, like that audience member said before, you won't like as much noise and distraction going on around you. So if you have an important activity to do, you want something to focus or concentrate on, turn off the TV, turn off the radio, put away your smartphone, which is the ultimate distractor, and just concentrate on one thing at a time. Take breaks. Someone mentioned fatigue before. Unfortunately, the type of fatigue, as you know with MS, when you have it, you can't push through it. You can't work through it. It just needs to resolve. So by taking breaks, it means that you're pacing yourself a bit more during the day. And then next to that, which we touched on a couple of times too, so I want to explore it a lot, is managing your fatigue and your mood. Take breaks. Be aware that after having a really hot day, you might be more fatigued. So try not to plan in anything too important. If you're experiencing low mood, anxiety, any of these types of things, don't be afraid to reach out to your GP, or if you have a psychologist or a counsellor, or a psychiatrist. We're really lucky in Australia that through the GP we can get access through Medicare to see a local clinical psychologist or a psychologist. And if you are thinking you would like to see a psychologist, psychiatrist, please, broach it with your GP, because it might not just be that you can assist your mental health. It might also be that you also assist your thinking and memory skills as well. Okay, now the last one is actually memory strategies, and apologies, I just have to wipe my nose. I put this last because I find that this is what people seem to benefit from the most and what is the most easy thing to access. So there's lots of different learning and memory strategies that we can use. And once again, it's important we base this on a bit of data about how our thinking and memory is working. So the first one is learning techniques. So chunking itself can be a learning technique. Repetition for some people is also an amazing learning technique. So I actually give a test which is called a list learning task, which starts with, let's say, I don't know, just for the sake of the talk today, 10 words. And I repeat that list of 10 words 5 times to people, seeing each time how many words that they can learn. Sometimes people will start off at 4 words, but by the time we get to the last trial, they've had 3 or 4 or 5 repetitions, they're learning 10 words. So in other words, they're taking in more and more with more repetition they get. Another great learning technique can be story learning. We know that by adding context and meaning to what we're learning, that can sometimes help our ability to take in and remember information. So a great example of this is, let's say you're trying to remember a list of grocery items because you want to make dinner for someone. Rather than trying to remember the list of items, remember the recipe. So let's say if I'm making spaghetti bolognese, don't just remember, tomato passata, meat, herbs, onions, spaghetti, whatever you put in there. Remember the recipe, because that will add context and meaning. I can see it in my head, I can almost smell, I can walk my way through what I'm doing when I'm cooking the bolognese, and that will actually help my ability to remember it. A lot of you raise this when I ask what sort of strategies you use. Using external aids is really useful. So things like diaries and calendars are fantastic. Notes and notepads are really good. Even whiteboards, which I love, are fantastic. But I would say though is that when you're using a diary or a calendar or notes and notepads or a whiteboard, there still needs to be a system in place. I've walked into people's houses who are using fantastic memory strategies, but they've got the diary there, they've got the calendar on the wall, they've got sticky notes on things, they've got a notepad, they've got a system that doesn't really work. So sometimes just focusing on using a couple of these things, the things that work best for you, can be really good. Now, once again, that can be technology in the sense of a smartphone or a computer program, or even smartwatches can be pretty amazing for reminding us of things. But for some people, they actually prefer paper diary or a paper calendar or notes. If you are going to take notes, use a notepad, have them all together in one place. Don't just have them lying around, because then there's no organization to what we're doing in that space. If you are using a whiteboard or a blackboard, interestingly, there's 2 places I always recommend putting it. The first is on your fridge. We always look at our fridge, and maybe the people in your family or friends look at your fridge as well. So sometimes putting a whiteboard on the fridge where you can write down messages for yourself or for other people, or have a calendar, can be really useful. Also, the back of the toilet door is another place that we look at quite often. It's not worth having whiteboards or blackboards or calendars unless they're in a place that we're going to look at, because sometimes we actually ironically don't remember to look at them. So it's important that it's there. The last one there is actually imagery. This is really what I'm talking about today, is only touching on the surface of different thinking and memory strategies. But imagery is a way that we can imagine things to help our memory. So there's actually a great technique called method of Loci, which is a bit like a brainwave where, I can't remember the audience participant's name, so I apologize, where they left out the grocery item so they'd remember to buy it. Method of Loci is where you close your eyes and you imagine your house or a part of your house. And then you actually imagine yourself looking at items in your house, like you're walking through in your imagination, your house, and putting an item somewhere like, I'm going to put the bread in the cupboard, I'm going to put the cheese in the fridge. What this does basically is taps into our memory for visual information, not just writing down a list, not just remembering what someone said to us, but actually literally seeing things in our head and remembering it. Because interestingly, when you look at an apple or when you think of an apple, like to see an apple in your head, a similar part of your brain lights up. So method of loci, which is where we walk through our house or a location with different items in it. Once we walk through that location again in our head at a different point in time, often we actually remember different things from within our house. I've used this with really good success, particularly when people with MS, maybe their learning and memory for things they're hearing, verbal information is not as strong, but their learning and memory for visual information is very strong. So they can't take in as much what's said to them, but they're still good at remembering what they see. This method of loci technique can be really useful. So I'm going to ask Andrea to throw a poll into the field, and then I'll take some questions. What is the main memory strategy that you do or would like to use?
So here you go, that poll is launched. So you can choose which one you think you either do use or would be most likely to use. Would it be learning through stories and context? Would it be learning through repetition? Maybe the use of notes, a notepad or a whiteboard? Maybe it's the use of a diary or calendar, or maybe imagery struck a chord with you. Pop into the poll your answer to that question. What's the main memory strategy that you do or would use? And we'll share the results with everyone. That's great. There's lots of comments coming through too, Luke, so we're ready for some questions if we've got time and if you're able to stay. That's great. A couple more people want to vote on that poll, and then I'll close that off. Anyone else? That's great. A couple more people. That's fabulous. All right, I'll close this off and I'll share the results with everyone. So an overwhelming vote for the use of a diary or calendar, 68% of people saying that that's their go-to or something they're going to try. And then 17% the use of notes, a notepad or whiteboard, and then a smattering of the other things as well. That's great.
Good,
thanks everyone for sharing. Certainly a memory station is something that we've talked about in the past, about having that one place to keep things, and the bills and the notes all go in the one spot. That's great. Thank you.
And often when I work with people around, thinking and memory strategies, often where I'm coming from is a place of research and knowledge about different rehabilitation programs. But as I said, people come up with their own ideas. And if it works for you, that's fantastic. The thing that I would point out though, particularly with diaries and calendars, is making sure that you have the right diary and calendar that works for you. And keep in mind that particularly, with paper diaries and calendars or electronic diaries and calendars, there's so many different options of how you can lay out your day or your week or your year, and each one works differently for people. So for example, with my paper diary that I use when I'm booking appointments, I like lots of room on my day so I can put down details about, why am I going to be doing an assessment for someone, what their contact details are. Whereas other people might just need a diary with one line for the day because it's simply just putting in what's happening on that day. So Andrew, I think we have time for some questions and I'm happy to hang around. But I just wanted, before we do that, to say thank you so much everybody for attending today, and thank you Andrew and MS Australia for inviting me today. I hope you've enjoyed the talk.
Thank you so much, Luke. I'm just going to pop back to a general questions slide. Hopefully that's visible for people. Let's see what people are seeing. Yep, great. So there's the contact number if you need that, because we encourage you to follow up after today. So, and excuse me, I'm looking across to my other screen, but a question that might be challenging for people is, would we expect our memory to get worse as we get older?
So in a general way, regardless of whether we have a condition like MS, we know from research that our memory does become less efficient as we get older. But in a general way, in a general terms, normal aging, means that it wouldn't get so inefficient that it would really severely affect your life. So even though our memory does become a bit less efficient, usually it's not so severe that it starts to really restrict our ability to remember things in our day-to-day life. Usually we get concerned about memory when people are saying, you know, I really can't do things that I used to be able to do. The great thing about the tests that I use when I measure thinking memory is I use normative data, which is information about, let's say you're a 60-year-old person and I've given you a memory test. I will then go and compare your performance to 60-year-olds. So all the data I have and how I make my comparisons of whether your memory is normal for you is actually compare you to people of your age, which means it takes into consideration aging as well.
Yeah, that's great. And someone popped in the comment in regard to neuropsych assessments, that for people to remember that there are also neuropsych clinics associated with some of the teaching universities where you might be able to access a student clinic. So
for a lot of people, depending on your NDIS package, for example, you can access a neuropsychology assessment. For example, in Melbourne, in Victoria, there are university clinics which will give you a discounted rate, usually, about having a neuropsychology assessment done. And in fact, if I'm doing a private assessment for someone and they say, look, unfortunately, I can't afford a private assessment, I'll often refer them onto the university clinics. Usually you have to wait a bit longer, but often the quality is really good and usually it's at a discounted price. So that's great to point that out.
Yeah, that's it. And the process would be to talk to your neurologist or your GP for that referral?
So look, it's always good to speak with your medical professional, whether it's a specialist or a GP first, particularly if they think you need it. But ironically, with neuropsychology, you don't actually need a referral from a medical specialist, although we usually welcome one, because usually what that does is allow you to access Medicare. That's why you might get a referral from your GP to a specialist, as well as obviously wanting to see them. Usually it allows you to access Medicare. And unfortunately, neuropsychology assessment, a cognitive assessment, is not covered by Medicare. So I have people with MS who will call me or email me and say, look, I just really want to know for me. I just really want to know how my thinking memory is. And if there are issues, I want to work on strategies. And usually they're happy for a copy of the report to go to the GP, but often I don't even need a referral from the GP. So you can actually see a neuropsychologist without a referral, even though we'd welcome it. And it's always good to discuss it with your GP or your medical specialist.
Great, thank you. What about, is there a way of assessing whether a memory issue is a symptom of MS or other general health issues? Are you able to distinguish that?
Look, it depends. Sometimes the different conditions we live with, whether it's a medical problem, a mental health problem, they do have overlapping symptoms. But yeah, you can. So a great example that I can give you, and I'm not giving you any names or dates, so I can tell you about it, is many years ago, I assessed a gentleman with MS. And unfortunately, he also was someone who drank a lot of alcohol, like very high levels, you know, pretty heavy consumption of alcohol. And what was evident from his memory profile is that his memory, which wasn't great, to be honest, appeared to be much more affected by his alcohol use because he did have more forgetting than you would expect for someone with MS based on his brain scan, where the MS was in his brain. So it's not always a perfect thing. Often we have to monitor this over time to see, is it more mental health? Is it more MS? You know, you can imagine that if you came and saw me and we identified a learning problem, and then a year later, when your mood had improved, you're much happier, your memory improved, there's probably a bit more memory, so sometimes you have to monitor it. But our tests in general can allow us to tease this stuff out a bit, even though we might have to do it over time.
That's great. So that would apply to, there's been a couple of comments, that would apply to things like dealing with a post-traumatic stress disorder, or even Absolutely. The impact of being in COVID lockdown?
So depending on the individual, and I'm talking in generalities here, research suggests, so for example, for people living with PTSD, they can actually have a memory problem caused by PTSD. We know that obsessive compulsive disorder, for example, can cause some difficulties with Visio Spatial working memory, Visio Spatial skills. So we're lucky in Australia that neuropsychologists are really well trained. And if you see a neuropsychologist, they won't just think MS because that's your major diagnosis. They will look at your mental health history, your medical history, your physical history. I talk to people about their sleep in case they have obstructive sleep apnea, because that can affect your thinking and memory. So we really try and cover all those bases. We don't just assume that because someone's coming to us with MS, and reporting memory and thinking memory problems that it's all MS. We need to be really careful about that.
Thank you. Any preparations that people should do before having their neuropsych assessment?
Yeah, absolutely. Try and get some good sleep. That can be hard when you're feeling nervous, but I promise it's not as scary as it probably is in your head. Most people just feel like they're back at school a bit. That's usually how it feels. If you can, please refrain from using any drugs or alcohol. What I mean by drugs is not your prescription drugs, the non-prescription recreational drugs. I had a young guy to turn away because he had smoked a bit of cannabis the night before. Don't try and overthink it. Don't try and look up tests so that you can practice. In fact, that influences our results in a negative way. Because if we get practice effects, which is you're doing well at tests because you've practiced them, it actually can hide MS symptoms, and that means that we don't get a clear understanding of your brain. But also, I'd really encourage you that if you have any questions before coming into the assessment, just ring your neuropsychologist or write them down. And before you start the assessment, just talk through your neuropsychologist. We know that having a neuropsychology assessment is not something that's really common. So we're really well prepared to answer your questions and help you feel comfortable about what you're about to do and what it means.
And how often would you have a repeat assessment to see if there's change?
Yeah. Look, it depends on the individual. We know, and you guys know, that treatment for MS now is so much better than it used to be. You know, our understanding of MS and the treatments we have means that for a lot of people, their progression is either stable or slow. So it will depend on how your trajectory has been with MS. It will depend on whether you have anything else that might be affecting your brain. It will also probably also be based on discussions with you, your family, and your medical specialist. We aren't saying like come back every 6 months unless there's a really important reason to do that. Often I'll say to people, come back in 18 to 24 months or when you think there might have been a change. Sometimes I see people a couple of years down the track, sometimes I see them 5 years down the track. Each one's an individual, but it's not like seeing your physio, you do it every week. You might see a neuropsychologist to work on your thinking and memory strategies every week, but this big assessment where we look at your thinking and memory in 3 or 4 hours, that doesn't happen every week.
And something I really appreciate from a neuropsych assessment is actually the highlighting of person's strengths.
Absolutely.
So the areas that are working well.
And we forget about that. I think sometimes we really get stuck in the pathology, whereas it's really important to recognize that you will have lots of strengths, and the more we can tap into them, the more we can recognize them, the more we can use them as strategies, the better it's going to be.
That's great. Do you have a comment on medication for cognition? Example, dexamphetamine.
Yeah, so look, I'm not a medical specialist. I don't have medical training, so I don't usually comment on medication. And I always jokingly say that to people that if I ever give you a medication, you probably need to call the police. But I do know that they've looked at different forms of amphetamine for thinking speed and for behavior change that can what's called apathy. Sometimes people with MS can develop apathy, which is where you're not as motivated or interested as used to be, even though you're not depressed, so you're not sad, you're just apathetic. And from what my medical colleagues told me, there wasn't great evidence for that. In fact, it made people pretty unwell by the sounds of it. So please defer to your medical specialist for that sort of question, because I'm not a medical professional, but I myself don't know of anything obvious that I've been looked at in research or been told about from my MS specialist colleagues.
A couple of people asking about brain atrophy, so that natural process that the brain shrinks with age, but that we know in people with MS it actually happens a little bit quicker.
Yep. So brain atrophy is a normal part of aging. Atrophy just means shrinking of our brain. When you get an MRI brain scan or a CT scan or a different kind of brain scan, really good radiologists and really good programs should be comparing your brain to people of your age in the same way that I compare your memory scores to people of your age. So that's usually the best way we can tell whether you have any more atrophy due to MS, because it's usually beyond what we would expect for your age.
That's great. A couple of comments about so dealing with some potential change or the contributing factors to a maybe slow process. and commenting on the open plan work office and how bad that is. And I thought I'd just throw in that if people are at work and needing support for this, I'd encourage people to check out the MS Employment Support Service, because there are some fabulous supports available, government funded, to help people maintain their work and have the best experience in work as well as living with MS. So yes,
so
it can be really
there was a trend. Yeah, there was a trend many decades ago to have open plan work offices. We know from research actually that these aren't great for a lot of people, not just for people with MS, but for people in general. And a lot of organisations and companies now are actually reversing that trend and going back to much higher petitioned offices or having just your own office. So I completely agree with you. And particularly when you're talking about this idea of learning, concentration, even that executive functioning, the more busyness going on around us, the more we're trying to split our concentration between things, the more we're trying to hold in our head, often the less efficient our thinking and memory is, and therefore that does affect our performance.
Yeah.
I have been known on one occasion to make a very strong recommendation to someone's employer that they needed their own office. I don't know how that went down, but it was one of my recommendations.
Totally. And the ESS team will actually help have those discussions with workplaces as well. Yeah.
Great. Great.
A comment on neural reserve, cognitive reserve.
Yep. So cognitive reserve is this idea. So how can I explain this? How intelligent you are, how smart you are, is actually not based on how many brain cells you have. It's actually how many connections between your brain cells you have. So when they, on autopsy, measure the brains of people who have passed away who are really intelligent, their brain is heavier. It's not necessarily bigger. So this idea of cognitive reserve is that, and it does work in this area, although it's not a perfect idea, is that the more connections between your brain cells you have, the more connections you have to lose. And therefore, often for people who have a higher level of intelligence, higher level of cognitive abilities before they get something like MS, for some people the progression is slower and they maintain their abilities a bit longer. We know that this does ring true for a lot of different progressive neurological diseases, but it has to be considered on a case-by-case basis. It's not a general rule that applies all the time. But cognitive reserve is a real scientific thing that's been shown.
I'd encourage people to check out information on MS website on brain health, because there's that school of thought around what can we do to make sure we keep our brains healthy, and doing novel and different things. Someone popped in before that they were attempting to go back to the piano after having learnt it as a child. Those activities
you're promoting your plasticity. Plasticity is those joining of your brain cells, making new connections. I'd also reinforce that, Andrew, by saying that the MS Australia website also has a great cognition information sheet. In fact, I think it's one of the better ones I've seen. So if you did want some more information, I really strongly recommend you look that up and have a read.
So just for clarity, that's actually two places, because MS Australia is a different website to ms.org.au. So now that's a couple of places to have a look. But yeah, there's lots of information about. Thank you so much. I don't actually want this to be the final question, so I'll come up with another one. A rough idea of how much a neuropsych assessment costs?
Okay, so it will depend on a few different things. So it will depend on whether you have a way of funding for it. So for example, NDIS will definitely cover neuropsychology assessments if it's in your plan, and you can always talk to your planner about whether you want that in your plan. Unfortunately, a lot of private health insurances don't cover neuropsychology assessment, although in my experience, occasionally they do. So I always say to people, just double check. If you're someone who's covered by like TAC for brain injury or Departments of Veterans Affairs, if you're a veteran with a gold card, you might be covered. There are lots of different public clinics, often associated with movement disorder clinics or MS clinics, where you can access a neuropsychologist publicly, which is always a great option. We talked about those university clinics before. If you're wanting to access me as a private neuropsychologist, everyone's rates are different, by the way, so I'm just talking about myself here. Generally, I charge about $180 an hour for the report writing and for the assessment. So you're looking at about 6 to 8 hours of work for $180 an hour. That's for a general assessment. We might charge more for medical legal type assessments. The Australian Psychological Society recommended rate, which we can alter depending on what we think, is actually $260 an hour. And they've calculated that based on research through, you know, and economics, etc., to see how much it costs. A lot of neuropsychologists don't necessarily charge that much. I would only charge $180 for a routine assessment. But if you've got any questions about costs, just ask. Just ask the neuropsychologist. Ethically, we are bound to be incredibly upfront about the costs associated and involved. And often neuropsychologists, if you can't afford a private assessment, might give you some other options as well.
Are people with MS more at higher risk of dementia?
Look, it's a really tricky question. This term, this idea of dementia is a difficult one to discuss because usually it scares the pants off people. As a general term, dementia is defined as when your thinking and memory, the decline in your thinking and memory is so severe that it is really restricting your lifestyle, meaning that your functioning is really poor now because of the thinking memory changes. Technically, that's dementia, whether it's caused by any progressive neurological disease. We don't generally use the term dementia in MS. We don't usually associate it in that area. That's just the technical definition. And to be honest with you, even though I'm not minimizing that term and how we use it in different medical settings, it's kind of arbitrary in some ways, because when do you get dementia? Like overnight? Is it one day that your memory suddenly slips into a zone where suddenly it's really bad, you have dementia? What we're really recognizing is that different levels of thinking and memory change will affect your day-to-day functioning differently. Some people have thinking memory change that's really mild and they don't even notice it until they come and see me. Other people will really notice it and it's really affecting them. So the important thing is how you manage it. You know, getting it assessed, but then how do you manage it day to day? It's a bit of a controversial thing, but technically that's kind of the definition of dementia.
Actually, that's a great place to finish. Thank you so much, Luke. But that idea of working with your strengths and managing the things that are perhaps problematic, but finding a way to work around them, that's great. Thank you so much for your time, and thank you everyone for being online. It's been a wonderful interactive session, so thank you so much. We'll look forward to seeing you at future webinars. This program has been recorded, so it will be up on the website for you to review again later. Thanks everyone, and thanks again, Luke, for your time and your expertise shared with us so well today. There's been lots of thank yous coming in.
Cheers, thanks a lot, guys.